We are live now, and right. So, hi everybody, welcome to episode number 76 of Ask Me Anything with IMAMS. Today we have Dr. Indranil Dutta with us, and he will be talking everything about placenta previa. Dr. Indrani is a highly established professional in his field. He specializes in high risk pregnancy management, and he's been practicing for over 10 years. But he's been dealing with the high risk pregnancy specialization for over 4 to 5 years now. And today he'll be answering all the questions and all the doubts about this particular topic, because this is a very, very concerned issue during pregnancy. So maybe you can take it over, doctor, and probably start speaking about the topic and educate everybody about this topic.
Hi everyone, good evening. I'm very happy to be part of this wonderful initiative by the team iMums. So basically, I have been asked to discuss something about the common queries related to bleeding in pregnancies, particular reference to the placenta previa. So before we go into that, I would just brief you regarding what is actually bleeding during pregnancy and what can be the particular causes for the bleeding during pregnancy. Now, bleeding during pregnancy can be early or late. It can be seen early during the initial pregnancy period, that is within first 3 months, even sometimes during the middle 3 months to the 6 months, or the last trimester, that is the 6 to the 9 months. So there are various causes. We will not go into particular details, but I'll just brief you what are the causes. Sometimes bleeding during the early pregnancy can be due to abortion or some signs and symptoms related to threatened abortion, like any particular patient who is a high risk patient of or who had a previous history of abortions, or due to the wrong implantation, like ectopic pregnancy, like implantation in the tubes or the fallopian tubes, which are known to carry the fertilized ovum, or due to some other features like hydatiform mole. We'll not go into such details. But the main causes why this miscarriage occurs during the first trimester, that is the first 3 months, is mainly due to some chromosomal anomalies, abnormalities, or due to some uterine abnormalities in particular. Sometimes there'll be some bleeding noted due to some other problems during the mid trimester, that is usually due to cervical incompetence, or due to some active infection during the pregnancy period, or due to some fibroids which are present, which are also known in lay language as tumors in the uterus, which can cause some sort of minimal bleeding. But rest assured, not all bleeding leads to pregnancy losses, and we are there always to serve you, mainly focusing on the topic which is vaginal bleeding, which is seen due to sometimes due to placenta previa, or during usually which complicates during the late pregnancy. One of the major causes is placenta previa. Now, what is placenta previa? Placenta previa is basically when the placenta, the particular, there are two parts of the pregnancy, which is one is the baby itself per se and the placenta. This placenta supplies is the connection between the mothers, the uterus, and the baby. It supplies the essential nutrients and is responsible for all the whatever supply of the nutrients, the bloods, or exchange of all the fluids among the between the mother's blood and the fetus, the growing fetus. So sometimes this placenta, if it is implanted in the lower segment, or in the particularly covering the cervix, the cervix is the opening of the uterus, where through which, if the pregnancy nears the term, that is completes its term of 9 months, will go into delivery. So that is the place from where the baby delivers. So that is the mouth of the uterus, you can tell. So if it implants, so naturally anything which blocks the mouth of the uterus, that is the cervix, naturally can lead to some sort of bleeding. This implantation can occur in the early trimester, that is during the pregnancy. Initial period of the pregnancy may lead to some sort of spotting or some sort of minimal bleeding in the first 3 months of the pregnancy, which can obviously be scary for the patient. So sometimes this placenta previa can also mimic some other symptoms. We will not go into those details, but this placenta previa does not always lead to pregnancy losses or leads to complication. Yes, but once we hear about placenta previa or your doctor tells you about placenta previa, you should be a bit more careful concerning the things which I'm going to tell you, because placenta previa, when the placenta is implanted in the lower segment, there is always a chance of some sort of heavy work causing some sort of injury to the lower segment, or some sort of stretching of the uterine muscles or the cervical muscle. That is the, as I told you, the mouth of the uterus can lead to stretching and some sort of bleeding. In these cases, the patients are usually advised absolute bed rest if placenta previa is diagnosed. And absolute bed rest means absolute, and some sort of supportive treatment is given in form of some progesterones, some medicines. If there is a active bleeding, some medicines to control the bleeding. So need not worry in such cases, but yes, we should keep that in mind that there is always a chance of some sort of heavy bleeding. So it should be taken in serious matter. This placenta previa can occur during the can gradually be relieved of, like it is not like permanent if it is in the first trimester, because as the uterus keeps going, there is a chance of the placenta previa being going away, because the uterus will grow and it will stretch the placenta upwards towards the upward segments, away from the cervical opening or the internal os. So there is always a chance there of it recovering. So there is need not worrying about the placenta previa. Yes, placenta previa can create some sort of problem if it persists, and if it continues beyond the 3 months, goes into the 6 months, or even during the last trimester, that is the 9 months of the pregnancy. Particularly in those cases who are pregnant for the second time, or particularly those cases who are pregnant for the second time after cesarean section, previous cesarean section, because there is a chance this placenta may be adherent to the uterine muscle. So again, if we know about the condition, there is always facilities. We have all sort of facilities. The guy, your gynecologist has to be informed about the condition. If you're changing gynecologist, the particular gynecologist should know that there is a placenta previa like thing. All the precautions, if taken accurately, may lead to successful outcome of the pregnancy. Now coming to the late pregnancy bleeding, again placenta previa is one of the cause. I was dealing with the early pregnancy bleeding. Late pregnancy bleeding, placenta previa is one of the causes, followed by there is a term known as abruptio placenta. We will not go into the detail what is abruptio, but you should be knowing this condition, because sometimes the placenta may separate itself from the attachment to the mother's side. As I told you, there is it is attached to the uterus in a particular way, whether it's placenta in the lower segment or the upper segment. Sometimes there is a early detachment that may lead to some sort of bleeding, so may lead to abruptio placentae. So those are not seen in all the cases. Sometimes if the patient is has hypertension and it is uncontrolled. So again, it comes to dealing with your pregnancy with utmost care. Every pregnancy is a precious pregnancy, and it has to be dealt with utmost care. If you are diagnosed of having hypertension early in pregnancy, you should be taking your medications accurately, because if you're not taking your medications, it may lead to all these conditions like abruptio. There may be other problems like low birth weight. All those problems can be there. So you need to again follow your doctors. Again, sometimes during the late pregnancy, we can see that there is a minor some sort of reddish discharge sort of thing during the late pregnancy. Again, we need not bother about that late reddish discharge, because sometimes it can be due to some local infection. We need to go to the gynecologist. Yes, if the discharge is associated with some sort of abdominal pain, then it can be a problem. So that's why coming back to the placenta previa, so always there is a chance of placenta previa, and particularly I told you cases of previous cesarean sections, previous any uterine any surgeries. Sometimes it can happen due to it can happen by itself. So need not worry about the placenta previa condition as such, but it has to be diagnosed early. Hence, your correct visits, your antenatal visits to your gynecologist during a pregnancy period is very important, particularly the times of the first trimester, the mid second trimester, early second trimester, sorry, then the mid second trimester, and particularly during the third trimester, during the 8 months, and the last during the 9 months. So I think you would have understood what are the problems. Now, placenta previa. Just one more minute. I'll explain about the placenta previa. What are the complications which can occur? So one is I told you there can be bleeding. Then another problem is the placenta is in the lower segment. Sometimes there can be malpresentation. Malpresentation means the baby can be positioned in such a way that the head is not cephalic, that the head is not down, it is not getting engaged into a lower segment, because obviously the placenta is covering the lower segment. It may lead to breach. That is, the presentation may be the buttocks, which will be the presenting part. That is a lower part, presenting part may be the buttock, may lead to, or there may be lessened chances of normal delivery in these cases. Or it can be transverse lie. Maybe the head or the buttock both are not engaged in the lower segment. So all these can be the problem of the placenta previa. Sometimes there can be early rupture of membrane due to placenta previa. So your diagnostic tool is always the early ultrasound and the follow-up ultrasound in case such things are diagnosed. So I think that will be something to brief about the placenta previa.
All right, doctor. Thank you so much. I mean, that was very, very educational. I hope all the viewers really, understood and their doubts. Now we'll be taking all of the questions. We have few questions that have already come up. So first question is by Soma Vedya. She's saying, "Hello, doctor. Why is my baby making movements mostly in the uterus or around the vaginal area? Though sometimes it's near the belly button, but mostly it's down here. Is it okay in 23rd, 23 weeks?" This is
23 weeks.
yeah.
So see what happens. The Usually after the 5 months, the initial movements of the baby will start. So you will perceive the movement for the first time at 20 weeks of gestation. This baby now, it is very small, so it doesn't occupy a particular place. Like, it is not like the head is down or the buttocks is down or the back is down, something like that. So the baby keeps moving, it keeps changing the position. So as the uterus is also growing along with the baby, so there is a chance of stretching and training of the uterine muscles, may lead to some sort of pain in the flanks area. Suppose the baby, the lower segment, the legs of the baby are towards the lower segment, there can be some sort of movement in the lower segment. So uneasiness may be there in the lower segment of the uterus. That is, the patient will complain of some sort of pain in the pelvic area, particularly towards going towards the flank. So you need not worry about those things unless it is associated with some other symptoms. You have to see for whether there is some associated white discharge, some curdy sort of discharge, or some sort of bloodish discharge. Then you need to consult the gynecologist whom you are particularly showing, to rule out any other infection due to the cause of the pain. Another thing which is commonly seen in the lower segment is the patient will complain of pain, and they will have burning micturition, they will have excessive urination. They, because pregnancy itself is such a state that there can be some associated infection associated, like urinary tract infection can be there. So you have to always rule out the urinary tract infection. So in case you are having that sort of problem, like there is some pain in the lower segment, you have to think about your symptoms. And if some such symptoms are there, as I told you, white discharge, urinary burning micturition, or some lower abdominal severe pain, or some bloody discharge, then you need to consult your gynecologist, and treatment is there for that. Need not worry. Otherwise, it's always natural to have that sort of pain during this mid trimester of the pregnancy.
All right, great. So we'll move on to the next question. This is by Nandini Rathan. She's saying, "Hello, doctor. In my second trimester anomaly scan, says that fetal minimal BC uh, pelvic follow up to post
Okay,
month."
pelvic tesis, fetal minimal pelvic tesis. So follow up to the post month. Okay. So
What is
what is
the
this pelvic tesis?
is
See if
there
it
any
is
problem?
written as, yeah, I understood. Is there any problem for the baby? So thing is, uh, I know it's very anxious to see the reports in particular, but I will tell you as a obstetrician and gynecologist, thing is, don't go into too much depth of the reports. See, minimal pelvic tesis means there is a dilatation of the, particularly the kidney area, the size of the kidney. There can be dilatation of the draining ducts from the kidney, that is a ureter. So minimal pelvic tesis is minimal dilatation. That is an ultrasound term. So yes, it can be due to some causes. Sometimes these causes can lead to these sort of dilatation. These sort of ultrasound diagnosis needs just follow up. So you have to just follow up. If this is just one ultrasound, just you have to follow up in the subsequent ultrasound, maybe preferably after 1 month of this particular report which you have done, and just see whether the kidney diameter is accordingly increasing in size. I think your radiologist or your gynecologist would have discussed with you that, and I don't think it should be a big worry for you, because minimal pelvic tesis is commonly seen in almost 4.5% of the anomaly scan nowadays. So don't worry. That will be my thing for you. And basically, it means that there is a dilatation of the kidney of
All
the
right.
fetus. Yeah.
Okay. So we'll move on to the next question. That is by Preeti Kashyap. She's saying, "Hello, doctor. I have pain in my lower abdomen, right hand side. It's my third month." So
Yeah. So I think, as I told you earlier, that
there's a bit of an
during
addition to her question. She's saying, "I had placenta previa in my first pregnancy 4 years back. Do I have any problem in my second pregnancy as I'm in my third month?" She's also having the lower abdomen pain in the right side.
no, is this a question from the same person?
Yeah.
Okay, so what she meant is she has some pain in the lower. Now she's 3 months, and she has some pain in the lower segment. And 4 years back, she had a placenta previa. See, I'll tell you, placenta previa, though it should not occur in the recurrent pregnancy, but if your case was like you have been operated prior to the previous placenta previa, like you are a case of previous one cesarean section, or you are a case of previous two cesarean sections where you have been operated in the lower segment, then there is a chance of repeat placenta previa. But as per now, hello, am I audible?
Yes,
Yeah.
Dr. Is audible.
So yeah, so basically now what has happened in 4 years back, you need not worry about that now. But I guess when you're 3 months pregnant now, so you would have gotten your ultrasound done, the early trimester ultrasound, that is during the 8 to 10 weeks of gestation period, or the early anomaly scan. I think you're 3 months, almost 12 weeks of gestation. So around 11 to 13 weeks, you would have undergone the NTNB scan, which is the early anomaly scan done from Down syndrome screening. And I think you would have seen the location of the placenta. So if the placenta is not there in the lower segment, just forget about that past history of yours. If the placenta is in the lower segment, then obviously you have to maintain some sort of precaution, that is not to do any heavy activities. There should not be any sexual intimacy during this period if it is a placenta previa diagnosed in the current pregnancy. And if you should not be doing any heavy work, as I told you, you should not be doesn't mean you should be always on bed rest, but yes, if you have had an active bleeding, then you should be on some sort of rest. But otherwise, if the placenta previa is diagnosed, just maintain a careful this thing careful atmosphere, so that you need not have to work more. But coming back to the pain, if you have some pain in the current pregnancy, 3 months or something like that, then need not worry, because as the uterus grows in size, there is some sort of stretching of the muscles or particular ligaments around the uterus, which leads to some sort of pain during the early trimester of the pregnancy.
All right. Fine. So we'll move on to the next question. That is by Manisha Singh. She's saying, "Hello, doctor. I am in 28th week. I am diagnosed with low-lying placenta. What should I do to overcome this?"
See, if you are in 28 weeks, you need not do anything. So basically, low-lying placenta can be of various types. So if your doctor would have discussed with you, basically low-lying placenta can be even where the placental edge is just 2 centimeter up to the os. That is, I was talking about the cervix, os of the cervix. That is the opening of the uterus. So if the placenta is 2 to 3 centimeter away, so sometimes that is also known as low-lying placenta. So in those cases, only if the you are trying for the normal delivery, and only if there is some sort of high risk things associated with your current pregnancy, like any other high risk factors, then only patient has to be very cautious. Otherwise, don't worry. Yes, what you have to follow is, if there is a low lying placenta, there is always a chance of some sort of bleeding can be there. So how to avoid that bleeding? So you have to maintain proper hygiene. First of all, you don't want any infection in the lower segment, because usually low lying placenta, because the blood supply is quite high in the lower segment of the uterine musculature, so there is a chance of infection getting ascending infection getting up. So if you are having any associated symptoms like white discharge, may lead to early rupture of membrane. So you have to be careful. You have to maintain the proper hygiene. Again, any sexual contact, if it is a low-lying placenta previa or a low-lying placenta, sexual contact has to be avoided during this time, so that you don't want to cause any injury to that area. You have to be careful if you are working from home, or if you are not working, then it's fine. If you are working outside and you need to go up the stairs or something like that, better to be avoided in this current situation. And particularly when you're 28 weeks, you're almost near to your the second half, you are into your third half of your pregnancy, the third trimester of your pregnancy, I mean to say that. So don't worry about the low lying placenta at this moment. And if there is only if there is a bleeding, then you need to consult your doctor, and then only you have to maintain some additional medications for the same. But at this present moment, don't worry for the problem.
All right, fine. So we'll move on to the next question, which is by Swati Biswa. She's saying, "Hello, doctor. I am today 11 weeks and 6 days of pregnant. On 14th June, I had sudden heavy bleeding without any cramps and a little back pain. Emergency USG says FHR is 171 and normal fetal movements are there, and told it's a threatened miscarriage. Any chances of safe pregnancy in is 50-50. I am on Sustain 300 and emergency injections. Bleeding is in control, but what should I do now?"
Bleeding is not controlled.
Is in control.
Okay, is in control. So how many weeks she told? She is 14 weeks.
Yeah.
Okay. So see, this threatened abortion, or this threatened miscarriage, or this threatened term itself is a very a term, I know it scares a lot of people. But believe me, nowadays in pregnancy, particularly when pregnancies have started coming late, and people have started taking pregnancies very late in their career life, and particularly some pregnancies due to have come after IVF and all. This sort of bleeding in the early trimester is commonly seen nowadays. I won't say in all the pregnancies, but it is commonly seen if uh, there are the pregnancy is usually taken late. This is what I have noticed. And threatened, if the report says that it is threatened and the fetal heart sound is around 170, and even if there is some collection around the in the USG, I think you don't worry. I think your doctor would have advised you for particular medications like Sustain, as you told. So Sustain is a very good drug. Basically, sometimes during the early pregnancy, the attachment of the placenta to the uterine bed is sometimes delayed, and this takeover process, that is the initially the due to some hormone, the pregnancy gets is getting carried on. So this takeover of this hormone from the mother's body by the placenta, this takeover system is sometimes affected during the early trimester. So this takeover period, during this takeover period, there is some sort of bleeding which is seen uh, near the placental bed where the placenta is attached. Sometimes it can be retroplacental just behind the placenta. Sometimes it can be at the placental edge. See, during the early trimester, the bleeding, there can be two causes. One is either due to some trauma or injury, or some sort of injury to your abdomen, or can be due to this sort of threatened sort of picture. Now, this Sustain and the some other medications, high dose progesterones, are usually given to fill up this void or this gap of progesterone supply which is there in the body, which may be preventing some sort of proper attachment of the placenta to the uterine musculature. But when once these medicines are started, I don't think you should be much worried about that. Yes, if there is active bleeding, then you should be little worried. But if there is no bleeding, as you told in your case, just rest properly. Don't go outside and in the current scenario, and take adequate rest, take adequate amount of water, take the your medicines in the correct times, particularly the progesterones. The injections, yes, they are most important. I think would have been advised to you weekly once, so they should continue. And you can get a follow-up scan after 2 to 3 weeks just to check if the baby is all right or not. So in that case, if there is no complication said after after 2 to 3 weeks, I don't think you should worry much about the current pregnancy. Just take rest and take and relax. And this is very common. The symptom which you are saying, early pregnancy symptoms like bleeding, is common. Yes, only if it persists beyond 2 to 3 days, like it is persisting for 7, 8 days, 10 days, 11 days, then it is some sort of worry, and you should consult your local gynecologist as soon as possible. But if the bleeding has stopped, just relax and take rest.
Okay. So basically, she said like it's 11 weeks of her, like she's in her 11th week. So is
Okay,
that
so 11 week also say the same thing, that placental takeover, some sort of bleeding can be there. So need not worry. I don't think she should worry because there is no bleeding at the present moment. Just
okay?
get a follow-up scan after 2 to 3 weeks.
Alright. So Swati, this the same thing applies to 11th week also. Please don't worry about it. Next question is by Mamta Upreti. She's saying, "Hi doctor, good evening. I'm 37 weeks pregnant. While sleeping on side, my ribs get hurt. Is it normal? Until now, I'm not having any kind of discharge. So is that also normal, or should I be worried?"
If you are not having discharge, you should be happy. Then why are you worried about that? So if you are 37 weeks, first of all, congratulations, you are in your 37 weeks. I know it's a pretty hard time to be thinking about pregnancy all the time, and considering the current situation. So once you have reached 37 weeks, don't worry about the discharge and all those things. Yes, if you are trying for normal delivery, you should, I don't know what you have discussed with your gynecologist, but if you are trying for normal delivery, I think you should wait for 2 to 3 weeks more for your any sort of discharge or any sort of pain to start. So just wait and watch. And one more thing is, during 37 weeks of gestation, just get a check ultrasound done whether the baby weight is adequate, or if there are any additional problems, or if the liquor is adequate, that is the fluid that is surrounding the baby within the amniotic sac. So all those things has to be checked at this point of time. I know there are a lot of problems with the scanning, and currently a lot of people are scared to go to hospitals. Consult your local gynecologist, get the check scan done, because at 37 weeks we are only worried about how the baby is, what is the baby weight, what is the how much amount of fluid is around the baby, whether the lower segment any dilatation is there, whether the placenta is in the upper segment or not. So these things have to be looked into once you have entered into the 37 weeks of gestation. Otherwise, don't worry if there is no discharge. Don't think about that thing.
All right, great. So next question is by Divya Bharti. Yeah, so she's saying she's in her 21 week of pregnancy, and her placenta is now 1 centimeter away from OS before it's completely covering OS. How long from OS is considered safe, and what are the chances of her normal delivery? I had normal delivery in first pregnancy.
See, again, that 21 weeks means you are around 5 months of pregnancy. So what I think by your question is, your placenta is now 1 centimeter away from the os before it's completely covering os. I think you meant that previously it was covering the os, now it is 1 centimeter away from the os. So if that's the case, see, as I told you in previous discussion with one of the patients, the uterus keeps enlarging. So after this 5 months, the uterus will keep growing. It will keep growing in size as the pregnancy progresses. As the baby weight increases, the baby will occupy more and more space, the uterus will keep growing. So this placenta also gets pulled up. So this placenta need not be in the lower segment. So the chances of the normal delivery at this stage, if you want to guess the chances of normal delivery at this stage, it is difficult. Yes, obviously we'll tell if for the normal delivery, the placenta edge has to be at least 4 to 5 centimeters away from the os, particularly in cases of if the patient wants to particularly try for the normal delivery. Os means that is the internal os. There are two categories of the os. You will not understand that thing, but from the cervix, it has to be at least 5 to 6 centimeters away. That is during the 37 or 38 weeks, not now. So at 21 weeks, you cannot guess like whether it will go for normal delivery or whether the placenta will move away or whether the placenta will occupy that position, because the uterus is still growing. And if your previous was normal, previously you had a normal delivery, so there is always a high chance of getting a normal delivery. And I think as the uterus enlarges, this placenta will move far away from the os. I hope so. Only if it was a previous cesarean section, suppose you had a first cesarean section, there is a less chance of this placenta. If this was a placenta which was in the lower segment, less chance of it moving away, leading to some other condition. But in your case, I think you should just wait and watch. Don't worry. Get your checks, ultrasound scan done after. I think you would have got your anomaly scan done. The next scan should be done at around 30 to 32 weeks. That is around 8 months of pregnancy. If at that time also the placenta is in the lower segment, then I think you should there'll be a less chance of normal delivery. But most probably this placenta will be in the upper segment by that point of time. So just wait and watch.
All right. Next is Bhavna Goswami. She's saying, "Hello, doctor. Please explain about low-lying anterior placenta. What are the pros and consequences of this? Any suggestions to take care for normal delivery? Thanks."
See, Bhavna, you have not mentioned how many weeks of pregnancy you are. Anyways, if you are in the early weeks of pregnancy, this is the first diagnosis. Suppose you have this ultrasound is done in the first 3 months of your pregnancy. So low-lying placenta is very common in the first 3 months of the pregnancy, because placenta can be implanted in the lower segment. But we cannot judge whether it will go for normal delivery or it will go for cesarean section now at this moment. Always remember that, because you cannot judge what will happen after 9 months of pregnancy. Yes, this placenta location can change as the uterus grows in size and volume. The placenta will also move upwards. The placenta per se will not move. The uterus will grow, so it will lift up the placenta to the upper segment gradually. If there are no associated complications like complications, I don't mean complications like previous surgeries. If you had previous cesarean sections or some sort of other surgeries which in the lower segment, only in those cases the placenta has a less chance of migrating upwards, or the uterine or going to the fundus of the uterus. But in your case, I think low lying placenta will be not to worry at this moment if you are in the first trimester, that is first 3 months. If you are in the last 3 months now, I don't know whether what period of pregnancy you are in. If you're in the 8th or the 9th month, there is hardly any chance that the placenta will get migrated towards the upper segment or something like that. And mostly you will go for a C-section with all the um, extra precautions like extra blood arrange and all those things. So if you are in the early trimester, or if you just want to know about the low-lying as an anterior placenta previa, don't worry, just wait and watch. And gradually, if the placenta is in the lower segment during the 8 months or 9 months ultrasound, if it is diagnosed as low-lying placenta at that point of time, then only you should consult your gynecologist for the whatever additional care you need to take for the delivery process. If it is low anterior placenta, even during the 8th or the 9th month, that is the placental edge is just within 2 or 3 centimeter of the uh, os, that is the opening of the uterus, then it obviously it will go for a C-section. If it is away more than 5 to 6 centimeter away from the os, then there are chances of normal delivery during the late trimester.
All right. Next is Shraddha Bhosle, and she's saying, "Hello, doctor. My anomaly scan at 19 weeks shows placenta anterior, not lying low, GD ratio 1. What does each of these terms mean?"
So placenta anterior means it is in the implanted in the anterior segment of the uterus. So anteriorly, if I look at the patient, suppose I am examining you, so your the side which is facing upwards is the anterior side of the uterus. The posterior side is the posterior one, which is towards your backside. So placenta anterior means it's fine, no problem. Not low lying means it is at least 3 to 4 centimeter away from the and the opening of the uterus, that is the cervix. So again, that is a good sign. And grade 1 in the initial trimester of the pregnancy, the placentas are usually grade 1. So as the pregnancy progresses, The placental maturity also increases. So maturity, they become more mature. Sometimes when the placenta becomes almost 8 to 9 months of when you become pregnant for the 9 months of pregnancy, that time the placenta report will show as grade 3, or there may be some sort of other associated things also. But at your stage, 19 weeks, don't worry about the particular report. I think the report is fine at this moment.
Okay, so next is Sandhya Dumeti. She's saying, "Hi doctor, I had ultrascan at 18 weeks and the baby weight was 228 grams. Is this normal weight or less weight? Also, I feel so hungry at night times. Any suggestions for that?"
See, at 18 weeks of gestation, the weight is not a much sort of big concern for us. I will tell you. Yes, it could have been plus minus plus not minus plus 100 grams or so, but I think this is okay. So if you so at 18 weeks, don't bother about the weight. It is the weight when we are bothered is when we get an ultrasound done at 8 months. And from that period of time, we are bothered about the weight in particular, particularly the weight, baby weight. So at this moment, 18 weeks, 228 gram. Sometimes it can be plus 100 grams, around 400 grams. All these are almost normal. So don't worry. Again, to your second part of your question, you feel hungry at night times, that is not a problem. I think if you are feeling hungry, I think in pregnancy the first thing which we advise our patients is you have to eat in small durations, but again and again, that is small quantities again and again, not duration. So if previous like prior to the pregnancy, if you were having three meals like breakfast, lunch and dinner, during pregnancy there are a lot of associated problems like nausea, more acidity, more constipation, more indigestion, all those problems can be there. So pregnancy, what we tell the patients is you should have your meals at a frequent interval. So have small meals but frequent intervals. Like I'll tell you, have a early morning little breakfast, then have something at 11 a.m., then have something at 1 p.m., like your lunch. Don't have too much of if you are like I'm in West Bengal also, there our population has a lot of too much of rice. After that they feel a lot of uneasiness. So have moderate amount of lunch, then again have something in the evening snacks, then have your dinner early around 8:30 9 p.m., then something to have at around 10 to 11. Like what I mean to say is you should have frequent meals at regular intervals so that you don't keep feeling hungry at particularly one time. Because in pregnancy, obviously the hunger will be more. There are more chances of associated other problems also like acidity, indigestion, all those things. So you have to be well fed, but at appropriate time. Well fed doesn't mean you have all the things at the same time, but have at particular spaces, as I told you, with proper spacing.
All right. Yeah. So next is Vasudha Mehta. She's saying, is it normal to have occasional upper left thigh cramp and left side abdominal pain during 19th week of pregnancy? Is anomaly scan scheduled between 20 to 24 weeks of pregnancy as per LMP or gestational age?
See, anomaly scan is always scheduled in our country because of certain rules. Like in case something goes wrong in the anomaly scan, we should get the like scan done between 18 to 20 weeks. That is what is usually given in the documentations and in the data, and that should be followed. 18 to 20 weeks means from the LMP, that is the first day of the last menstrual period. That is what is the date you would have given your obstetrician. So you need not see the gestational age at that point of time. Only if your LMP was wrong. Suppose you are a case of polycystic ovary, or you don't remember your LMP, or your LMP was not calculated properly, or you don't remember, and ultrasound was the only way of diagnosis of the gestational age. In those cases, the priority has to be given to the ultrasound gestational age. But if your LMP is accurate, I mean, if you would have got an early dating scan, that is the first scan which is done during the pregnancy, that is around 6 to 8 weeks of pregnancy when your pregnancy was first diagnosed, and your LMP and your scan had correlated at that point of time. Like that time by your LMP you were 8 weeks, and your ultrasound also showed that it was 8 weeks plus minus 1 or 2 3 days, then your LMP is accurate for the further calculation of the scans. Like if you are told NTNB scan, you can calculate from your LMP. If you are told anomaly scan around 18 to 20 weeks, again you can calculate from your LMP. So that is the important point to know. But if your LMP during the scan, during the first trimester, your LMP was showing 12 weeks, but your ultrasound showed that the fetal gestational age is around 8 weeks or 9 weeks. That means there is a 4 week discrepancy. That time, this ultrasound report has that gestational age of that ultrasound. Suppose it was 8 weeks in February. Accordingly, you have to calculate the gestational age and get the anomaly scan done. So LMP has to be is the most important. If it is correct, follow the LMP. If it is not correct, or your gynecologist has told that the LMP was wrong, then you have to go for the gestational age on basis of the ultrasound, the first ultrasound which was done. Now coming to your second part of the question, that is occasional upper thigh cramp. I would like to say in pregnancy, particularly if you are pregnant for the first time, there is some sort of leg cramps which occurs uh, due to pregnancy, very common. Okay, then left side abdominal pain also can be there, only if there is abdominal pain and if there is some associated discharge like curdy white discharge or some bleeding or something is there, then only you should be worried about the abdominal pain. Sometimes it abdominal pain may be associated with indigestion, so mainly it may be due to indigestion also. So you need to change your food habits. For the cramps part, if the cramps persist long enough, then there are certain drugs which are prescribed like carnitine, L-carnitines during pregnancy, which may help reduce the cramps. But I will tell you, this leg cramp is a part and parcel of the pregnancy, particularly if you are pregnant for the first time. So if you are pregnant for the second time, it will gradually cease off very early. So don't worry regarding that. But get your anomaly scan done at the correct time. So now, even though Supreme Court has extended the date of the medical termination of pregnancy, because if the something is wrong in the anomaly scan, we need to terminate that pregnancy. So we can do an anomaly scan from 18 to 22 weeks. But I still what we practice here is 18 to 20 weeks is the time when you should get the anomaly scan done, preferably at 19th or 20th week.
Okay. Next is Aarti. She's saying, "Hello, doctor. I'm having burning sensation in upper abdomen, both sides. Doctor said it's due to gastric problem, but I didn't have gastric problem. What may be the reason for this?" She also says that the doctor has stopped her iron tablets, but the pain is still remaining the same. Should I start taking my iron tablets by myself?
Okay, she didn't mention how many weeks pregnant she is. So
Um, yeah, she's not mentioned
yeah, so basically first 3 months of pregnancy, if you are in, I think iron tablet is started. So I think you must be at least 12 to 14 weeks plus of gestational age. That is at least 3.5 months or 4 months or something like that. So once the iron tablet is started, so this iron tablet itself causes some sort of problem. Sometimes if you're taking the iron tablet for the first time, it can cause some sort of gastric irritation, indigestion, constipation, dark colored stools. So considering if you are having the burning session in the upper abdomen, and particularly in the early second trimester, that is from the 3 months of pregnancy onwards, then it is most probably due to gastric problem only. But yes, I think your doctor would have stopped the iron tablet considering that. Now, if you are in the late pregnancy, I don't know what weeks of pregnancy you are. If you are during the 8th or the 9th month of pregnancy, so what happens due to the pressure effect of the uterus, because the uterus is growing. So what happens? The uterus is coming up to the, it is gone way beyond the umbilicus during the late trimester, that is 8 months or 9 months. So naturally, there is a pressure effect on the upper part of the abdomen, and particularly the gastric, all the gastric organs, particularly stomach and all those things. So directly or indirectly, it affects the digestion process, may lead to some sort of burning sensation in the upper abdomen. If there is a burning sensation in the lower abdomen or lower region, then you should be worried about urinary tract infection. But you are saying it's the upper abdomen, so no problem. I
Okay.
think she has mentioned it is 23rd week. Okay.
Yeah.
So if it is 23rd week, I think mostly it is due to gastritis only. if it is particularly in the upper abdomen and towards the area, particularly central upper abdomen. If it is toward the left or the right side of the upper abdomen, then you have to get your one check ultrasound done, which includes your obstetric scan as well as the upper abdomen, whole abdomen scan also. If you are having persistent gastritis, and you have to always rule out some additional problems like gallbladder stones and all those things if still it is not getting relief. But I'll tell you, it is not that, it is just plain gastritis. So take your some sort of antacids, some sort of antacid like pantoprazole and some sort of group of drugs. Take some good digestive enzymes like leaf vita enzymes after your lunch or dinner. Take some medicines to which will help in your digestion process. If still after doing all these things it is not getting cured, I think you should get one more check scan done for the upper abdomen, particularly to check for the any gallbladder stone and all those things, but not at this stage. This is just to give you information. At this moment, just keep your iron tablet stored for a few days. If it is stored for 1 or 2 weeks, nothing will happen. Just take your antacids on all those things. If your situation improves, then mostly it's due to iron tablets only. But if your situation doesn't improve, then you need to again, as I told you, get a check scan, which includes the upper abdominal scan also.
Okay. Next is Ankita, and she's saying, "Hi doctor, I'm in my 31st week, and in my fetal growth scan, my liquor is borderline 7 to 8. Is that any trouble? How can I increase it? Also, my AC as part of fetal biometry is lagging behind at 29."
Okay, so if you are 31 weeks and fetal growth scan shows that the liquor is borderline 7 to 8. See, 7 to 8 is the exact borderline. But if you are 31 weeks, then you need not worry much. I think you should be like even when your AC, which is done, if the AC is lagging behind at 29 weeks, okay. So that means there is a discrepancy of 2 weeks. But if there is a discrepancy of 2 weeks, don't worry that, because that is common during this time. If there was a discrepancy of more than 3 to 4 weeks, then only you should be worried. So what you need to do is take plenty of fluids. Take, I think your doctor would have prescribed you some arginine tablets or arginine sachets to increase the liquor. But at 31 weeks of gestation, 7 to 8 of AFI, that is the amniotic fluid index, is very common. So don't worry about that only. And if you are having no active leak or no active leakage of fluid from your lower segment or the vaginal area, don't worry about anything. Take plenty of fluids, and don't worry about that ultrasound parameter which says that 2 weeks lag is there. Yes, obviously you need to get a repeat ultrasound done after 3 to 4 weeks to see whether this lag is there for 2 to 3 weeks, 2 weeks only, or the lag is increasing. So if the lag is increasing beyond 3 to 4 weeks from your gestational age, suppose after 4 weeks you get an ultrasound done, that time you will be 35 weeks, and that time the abdominal circumference is around 31 weeks, that is a 4 weeks lag, that is a problem. But if you are after 35 weeks, your abdominal circumference is around 33, 34 weeks, again I will say don't worry about that condition. It is commonly seen because of the ultrasound result is always plus minus 1 to 2 weeks of this thing. Whatever measurement we take via ultrasound, there is always a discrepancy of 1 to 2 weeks. But don't worry at this stage. Just drink plenty of water and get a check scan done after 4 weeks. That is what would be my advice.
All right. So, I mean, it's already 6:50, and we have we have about 15 more questions to go. So, I guess we'll have to speed up the process a little bit,
Yeah.
right? So, yeah. So, next question is by Nidisha. She's saying she has a low-lying placenta and she has full bed rest, but sometimes her inner thighs have pain. Is that normal?
Yeah, again, I'll mention all of you to please mention your gestational age. Anyways, low-lying placenta and full bed rest, and you are having full bed rest, so no problem. Inner thigh pain can be there, as I told you, during the pregnancy process, particularly during the first trimester of pregnancy. Sorry, if you are pregnant for the first time, it is very common to have pain in the inner thighs. Don't worry. If you are having too much pain, then consult your gynecologist. They will prescribe you some medicines like Carnishore for the pain relief. But I think don't worry about too much about it. Yeah.
So next is Neha Khatri. She's saying her placenta posterior grade 2 is away from internal OS with single loop of cord around neck seen. Is this a topic to be worried? She's 35 weeks of pregnant, and yeah.
Yeah. So 35 weeks, placenta is away, so that's fine. But single loop of cord on the neck is also not a matter to be much worried about, because single loop of cord on the neck will be present in almost 20 to 30% of the women. Only if you are having less fetal movements, or the fetal movements have decreased, that is minimum of, at 35 weeks you should be having minimum of 10 to 15 fetal movements in the whole day. So if it is much less than that, then you should be worried and consult your gynecologist. If the fetal movement is good, just forget about the single loop of cord. Yes, again, you should get a check scan done after 2 weeks, because you will be nearing 37 weeks, just to check whether this loop of neck cord is still around the neck or not. So sometimes the cord also passes by side of the neck, and it can be interpreted as a loop of cord on the neck also. So that's why I'm saying don't worry about this thing. If your fetal movement is quite good, then don't worry. If the fetal movement has reduced, then obviously you have to consult your gynecologist immediately.
All right. Next is Vidhi Kothari. She's saying, I'm 25 weeks pregnant. My placenta is anterior. Is there any way I can prevent or reduce chances of placenta previa, like yoga exercises, diet, etc.?
No, no, no. Don't try too many things to prevent. And if there was a prevention, we would have advised you first. So only thing is, if the placenta is anterior, don't worry about whether placenta previa will occur or not. Exercises, mild exercises only recommended for pregnancy can be done, but don't do heavy exercises or don't do heavy postures in yoga, which may affect your the pregnancy in other way. Like too much of stress also in the anterior abdomen may not be good. So I will like to tell you that don't worry, and there is no such way by exercise you can prevent the placenta previa. Don't worry. If it is anterior, it will stay in the anterior only, up only. Yeah.
All right. Next is Alka Jaiswal. She's saying that she got her amniocentesis on 30th of May, and after getting positive report in quadruple test, her QF-PCR report was good, yet the Chirotype report hasn't come. She is in her 23rd week pregnant, and her age is 36 weeks. So, all my blood and anomalies reports are normal, but only the baby weight is less. Can she do anything about it?
See, what I guess, see, sometimes this quadruple marker test is, you cannot tell it is a benchmark of the all the tests. So once the quadruple marker test, because though it is a very good test, the lab to lab it differs depending on the sensitivity and specificity of the machine and interpretation. So if it was positive and if you have undergone this amniocentesis process already, so I would like to say that just wait for the karyotyping report. 23-week pregnancy, if there is anything wrong with the karyotyping, there is always ways to deal with it. But if it is, I think it will not be wrong. Yes, age was a factor, that's why maybe this thing, the quadruple marker test has come positive due to some reason anyways. But I think if the karyotypic report is normal, then no need to worry at this present moment. Just wait for the report. We need the report to know whether there is some karyotyping defect or not. But the QF-PCR report is good. That's quite good for the at present. Just wait for the report.
Okay, so next is Vartika Singh. She's 36 weeks of pregnant, and her AFI is 8, which is borderline as told by her doctor. Does she need to go for C-section after 2 weeks, because the doctor told her that she can't take risk if fluid suddenly decreases and causes problem?
Okay, so at 36 weeks, AFI should be somewhere around, preferably around 10. As I was talking in the previous case, she was just 8 months. So you are 36 weeks, around 10 it should be there. What you need to do is, if you are planning to go for elective cesarean section, if you are planning to go for C-section, these 2 weeks are important in such that you have to see whether you are having any active leak per vagina, whether you are having any pain which has started now, or whether your fetal movement has reduced. If any of these factors occur, then you have to get the pregnancy terminated as early as possible. But I think if you are going for elective C-section, you can go week by week, and you can get an elective cesarean section done at around 38 plus weeks, that is 38 to 39 weeks, after giving some medications, so that you can have a safe C-section, or if you're going for C-section. If you're going for normal delivery, you can wait for the time till your term completes, and then your doctor can put the like apply the medicines which are required for the normal delivery process. But AFI8, yes, it is borderline, but if it doesn't reduce after 2 weeks, you get a check ultrasound done. If it doesn't reduce, I think you can wait for one more week and get the C-section done. That is around 39 weeks. And if it is further reducing below 8, then I think you have to get it operated after 2 weeks if you are going for the C-section. Yeah.
Next question is by Karthyaini. She's saying she took a scan today. As per her last date of periods, baby is supposed to be 7 weeks, and one day, however, the scan only shows 1 week and 5 weeks and one day. She's a little worried. Is this normal? Scan suggested of 2 weeks.
Yeah. So see, your case is the typical case which I was discussing at the initial part of our discussion, which started. So if by your LMP it is 7 weeks one day, by your scan it is 5 weeks. This is quite common. So don't worry. Sometimes the date does not accurately match. So I think by 5 weeks one day, I think the fetal heart sound also wouldn't have been recorded by now. So what I think is advisable, that after 3 weeks you get one more check scan. That is, usually it is expected around 8 weeks of the pregnancy. That is not by your date, because now you know that there is some discrepancy in the date, and there is some problem with the date. But you can get a check scan done after 3 weeks, and if at that point of time the cardiac activity has already occurred and the cardiac activity has come, then well to go. Your pregnancy is fine. Only thing, the problem here is there is a discrepancy of 2 weeks. Don't worry about that. Once the cardiac activity comes after 3 weeks, just follow that date, the gestational age which is mentioned. That will be your point of correspondence for the further scans or further treatment. Don't worry.
All right. Next question is by. Just a second. Next question is by. All right. Next question is by Manisha. She's saying, I'm 2 months pregnant and I'm getting watery type discharge and smelling, which smells bad also. Is it okay?
Okay, if you are see, discharge during the early months of pregnancy is common, but if you are having a foul smelling discharge, or the discharge becomes curdy white or something like that, then I think you should get investigated once by your gynecologist, because your gynecologist, he or she has to have a look whether there is any active infection in the lower segment. So you need to bother about that one.
All right.
So
So
I think you should get, yeah.
So then next is Lopa Mudra. She's saying she's 12 weeks of pregnant. After today's NT scan, doctor said there is marginal bleeding in uterus. She's advised to take Susten SR. Is there something to worry, and is there any risk?
No, she's how many months of pregnancy? I didn't get you.
She's 12 weeks.
Hello.
Hello.
Yeah, she's how many months of pregnancy? 2 months.
12, 12 weeks, yeah. 12 weeks, yeah.
Oh, 12 weeks. Okay. So if there is a mild pain, yes, sometimes, see, as I told earlier, mild pain, we as doctors, we usually take, nowadays, all pregnancies are taken as high risk. So sometimes we give progesterones to, because during 11 to 12 weeks, the attachment of the placenta, which is supplying the food to your child, the attachment process gets delayed, or some problem is there. That particular hormone, progesterone, is not there. So this problem, just to avoid that problem, just to give that support, so that the placenta takes over from the ovaries of the mother, so that this progesterone is given. So need not worry, you can take the progesterone as prescribed by your doctor.
Okay.
Yeah,
Next is Priyanka Bansal. She's saying she was diagnosed with low lying at 11 weeks. And hello.
yeah, yeah. Tell me.
Uh, yeah, doctor, we can't see you. Your video is gone.
Okay.
Yeah.
Yeah.
All right. All right. So she's saying she was diagnosed with low-lying placenta at 11 weeks, and now she is 19 weeks. Her scan says placenta is not low-lying. Should I still be on bed rest? Plus, she's taking weekly injections.
So what injections? Weekly injections. Okay.
Hello.
So see, as I told earlier, so if it is low-lying placenta in the early weeks of pregnancy, 11 or 12 weeks, normally due to the advancement of the pregnancy, this placenta is gradually pulled up in the upper segment. So in your case, again, it is at this moment it is not low-lying. That's a good sign. So yes, you need not be on particularly fully on bed rest if you had no bleeding or nothing complication for last 2 months or so. But I would like to advise you that just maintain a bit caution, and bit caution means better not to have any sexual contact at the moment, better not to do any heavy work at the moment, better not to do any heavy activity at the moment. Just may do your normal household work which you do normally, or you can go for normal work also, provided you have the you don't have to climb up stairs or something like that. Don't worry, once your placenta is away, it will be away only. Just for the pregnancy sake, you have to be cautious.
Okay.
Yeah.
Next is Sudha. She's saying I am around 7 to 8 weeks of pregnancy with two fetal poles and no heartbeat. I had a very mild brownish discharge for 2 days. Doctor says he's asked her to come back for in a week for a scan. Is there a possibility of seeing the heartbeat now?
No, if you are 7 to 8 weeks by your date, or by your by your LMP, last menstrual period, if you are 7 to 8 weeks by your last menstrual period, and if the pregnancy inside the whatever pregnancy, the fetal pole is not seen, sometimes it may not be seen if there is a discrepancy between the last menstrual period and the pregnancy time, as we saw in the case, two case back, where she was 7 weeks and 5 weeks of gestational age. So in that case, sometimes the heart sound is not seen. But if your date is accurate and the gestational sac is also accurately up to 7 to 8 weeks, by now the heart sound should have come. So, but still, I would say that we as doctors, we always get a check scan done after 1 to 2 weeks. So you get a check scan done after 1 to 2 weeks, preferably at 8 to 9 weeks of gestation. And if still then there is no fetal pole, then there is a need to worry, and there is a chance that it is a case of blighted ovum where the fetal pole has not come. It is only the G sac and the placenta has come. So just get a check scan done after, preferably after 1.5 to 2 weeks.
All right. So next is Kasturi. She's saying she's 14 weeks now, and she had an NT scan in 12th week, and her PI was 2.6 in left uterine artery. Is that a
Okay.
problem? And her doctor suggested her 150 mg ecosprin, and she does not have any history of hypertension.
Okay. So if the PI comes like that, we doctor sometimes start you on ecospirin, so that because to prevent certain uh, complications which may occur later on. So in your case, as a patient, what you should be doing is you need to periodically measure your hypertension. Sorry, you need to periodically measure your blood pressure at regular intervals. You may not have a hypertension in your like previously, but pregnancy induced hypertension is also one term which can occur. So if some report is like this, then what you have to do is just get your this thing periodical BP checked and document it somewhere, so that when you go to visit your doctor, you can obviously show your report, and get your BP checked manually in between. Do not depend wholly on the automatic BP machines. Get your BP checked manually sometimes and just document it. So if the BP rises, there can be certain problems for the growth of the baby or some problems for the baby. So that's why the ecospirin is given. Usually we start with 75. Your doctor started with 150. That is also not much of problem, but I think just keep your BP under check and get it measured at regular interval.
Okay. Um, Next is Mamta Jadhav. We're really sorry, doctor. We are past the 7 p.m. and you're being very very cooperative with us because there are so many questions pouring in, so we have to. Is that
Yeah,
okay
yeah,
with
no
you?
problem, no problem. Yeah.
All right. So next is Mamta Jadhav. She's saying she had did her sono at 25 weeks, and one of the impression is two cords around the fetal neck. So is it fine, and what precautions have to be taken at home? She is on Dufilstone, Duvaldian, and Prolutone.
Okay, so see, two cords of loop around the neck. Uh, uh, like if it was one loop of cord on the neck, I'll say you need not worry. Two loops of cord on the neck, we just need to follow up. See, if the fluid, that is the liquor, if it is adequate, sometimes due to the baby movement, naturally the cord will loop around the neck. Only if it is tight enough, then it may cause some problem. If it is not tight enough, it will not cause problem. What I will say in your case, by now you must be perceiving your fetal movement well. So if your fetal movements are more than 10 to 15 in the whole day, then don't bother. If the fetal movement drops, then you need to get a check ultrasound done immediately. If the fetal movement is adequate, just get a ultrasound scan done after almost after 1 month of this current date of diagnosis of two loops of cord and the neck. Do not go too much into that because it may add to your headache and tension. Just keep measuring the fetal count. Keep a track of your fetal count. That is what I will suggest at this point of time. And you can continue Dufaston only if you are very high risk pregnancy or if you are IVF treated or something like that. But usually we stop Dufaston by around after 22 to 23 weeks if you have conceived naturally without any medications or interventions.
Okay. Next is Neeti. She's saying she's 24 weeks of pregnant, and her last scan during the 22nd week shows that the baby weight is 493 plus 75 grams. What can I do for the growth of my baby? Is what she's asking. Or
The
what?
baby weight is very accurate according to your gestational age. Plus minus, it is always 1 to 100 to 150. Yes, during the second trimester of pregnancy, you need to have the second or the mid second trimester onwards. You should have some sort of protein powders as additional supplements. If you are taking enough quantity of proteins and if you are taking any adequate quantity in diet, it is not required additionally to take protein powder. But yes, protein powder can be taken once in a day so that just like how we make Horlicks or we make our Bonvita drinks, we have particularly protein powders, any protein powder like Protein X, Mama Protein X, or Mother Horlicks or anything like that, you can take and once a day, which may help. But I will always tell you the age-old therapy for proper growth is your proper nutrition. Take normal nutrition which you take in your home in adequate quantities and in frequent intervals so that the growth doesn't get hampered.
Next is Satya
Yeah.
Narayan. She's saying she's 35 weeks of pregnant and she got albumin positive from urine analysis and also RBC. Is no RBC bacteria present? She needs clarification about the albumin and the RBC.
Okay. So see, RBCs sometimes you have to rule out. Sometimes they can be associated burning micturition, frequent micturition, like frequently you're passing urine, unable to control the urine, or a lot of burning micturition. You are having a lot of problems. You have to rule out urinary tract infection, which is very common during the pregnancy time due to various factors. That has to be ruled out. If the albumin is positive, you have to get your check on your blood pressures and whether the blood pressure is normal or not. If the urine albumin is positive, you need to, if you are around 35 weeks, I think you would have got your ultrasound along with the Doppler study done once. So get your ultrasound done. If the Doppler study was not done, along with it, get a Doppler study done just to be sure that the blood supply from the mother to the fetus is adequate and the fetus is not having any problem due to the blood supply. Other than that, need not worry about the details. If there is any problem in the Doppler or if the pressure is high, then sometimes the doctor may ask you for giving the urine for a 24-hour sample to see whether there is a urine protein in your sample for the same. But at this present moment, just see if you have a Doppler done. If you did not get a Doppler done, get a Doppler done for the fetus also.
Okay.
Yeah.
This is one of the last questions. This is Ankita, and she's saying her hemoglobin is as low as 9.4. She is 31 weeks of pregnant. Is that okay?
See, during the third trimester of pregnancy, there is a term known as hemodilution, which will occur. The hemoglobin usually drops. So previously, if it was 11, due to the growing child as well as some sort of other physiological process taking place during pregnancy, there is a chance of hemodilution. That is, the hemoglobin will fall also in the third trimester. But if the hemoglobin falls enough, more than 9, then you may need to have, because at this last stage, that is 31, 32 weeks, no amount of iron tablet can increase it above 11. So sometimes if it drops below 9, then you may have to take some iron injections to supplement your this thing during your pregnancy. That will increase your hemoglobin. But 9.4, I think it is not to worry much. If it was 10, it was very good. At this present moment, you just have your diet properly, take your iron tablets properly. If it further reduces, get a check hemoglobin done at 35 weeks or 36 weeks. If it is still around 9 or below 9, then you need to get a iron injection at that point of time. And if it further drops below 9, then you need to get a blood transfusion. But at this moment, don't worry about that. Just take your proper diet properly and take iron rich foods in particular.
Okay, there's one small question by Nutan. So she's saying, how can I remove pigmentation from my face during pregnancy? I mean, this is not
See,
related to the topic, but in case.
yeah, it's okay. You asked. See, there during pregnancy, there are a lot of pigmentation which will occur on the face, on the abdomen, and particularly on the lower part of the abdomen, which are known by various terms. The thing is, these scar marks, no amount of cream, whatever you apply during the pregnancy process, it will hardly reduce it much at this present moment. You can consult your dermatologist for the same. They'll give you some medication, but I will tell you, just wait for the delivery to get to occur. After that, naturally, this some sort of these scar marks will slowly gradually reduce, and it will gradually reduce to its original how it was prior to the pregnancy. If it doesn't reduce at that point of time, then only you take some medication, because in pregnancy we don't want you to overload yourself with lot of medications, lot of creams, lot of steroids, because dermatology medication usually involves some sort of steroids also. We don't want much of those medications to be applied on your skin at this present moment of time.
Okay, I guess there's one question by Pallavi Wagmare on our app. She's saying she's 18 weeks of pregnant and she got her anomaly scan done yesterday. Everything is normal except uterine artery screening Doppler. Mean PI is 2.0, which is
Yeah,
higher side. She's taking
yeah.
eco. Yeah.
I think it's the same question as the earlier someone had asked 2 question back. So again, if the mean PI is higher, you will be started on ecospirin as your doctor has started. You need to get your blood pressure checked at regular intervals, like manually checked, not automatic machines. Automatic machines sometimes you can check, but manually checked and documented, so that the next visit when you go to your doctor to check whether you are having some sort of pregnancy-induced hypertension. So if there is a pregnancy-induced hypertension, this aspirin is given to prevent certain complications which may occur due to pregnancy-induced hypertension. From your end, you should be only looking at the measuring the BP and make sure that the baby movement is at least 10 to 15 times in the whole day. This is has to be done from your end. Other than that, don't worry, because the more you think about it, the more it will go towards that side. So just relax, and there is a condition and it will be treated accordingly by your gynecologist if the problem arises.
All right. Okay. So, um, there's just one last question, which is by Shagun Gandhi. She's saying she is 35 weeks of pregnant, 35 weeks of pregnant, and her baby weight is 1,888 plus minus 276, and amniotic fluid is also low, which is 6.8 centimeter. Doctor has given her 3 doses of glucose twice in a week to increase amniotic fluid, and she says that she has to wait for 37 week. After 37 weeks, she can go for C-section, and her baby position will be. What should she do?
See, considering the baby weight at 35 weeks, I think you told 35 weeks, right? So, is it 35 weeks?
Yes, yes.
Yeah, if 35 weeks, yes, the baby weight is bit on the lower side. See, anything less than 2.5 kilo of the baby at term, that is 37 weeks, um, is usually little problematic for the baby to be delivered. So what your doctor is trying at this moment is he is trying to take your pregnancy till 37 weeks. That is the maturity according to our obstetric guidelines. So once at least you reach the baby weight reaches up to 2 kilos plus, then there is always a good chance that the baby will not have much problems as compared to the baby weight now. Yes, there has been some problem regarding the growth, and you need to take the medications. I think your doctor will also give you some steroids prior to the delivery so as to cause to help in the lung maturity of the fetus. So once the lung maturity occurs, I think your doctor will deliver the baby at 37 or 38 weeks, which where the baby weight has to be around at least 2 kilo plus with the, and obviously always remember at this particular condition you should deliver your baby at a setup where there is a NICU support, that is a neonatal ICU support. I think everything should be fine if you have that. Just take this next 2-3 weeks with ultra precaution and just move forward. If there is any absent fetal movement or the fetal movement has reduced, immediately contact your doctor, whether it's tonight or tomorrow or anything like that. If the fetal movement is less, that means there is some problem. If there is a pain which has started in the lower segment, then there is a problem. So all those things has to be kept in mind. If there are no such problems, then just continue till 37 weeks plus and then deliver accordingly. Yeah,
Okay, so I mean, we are left with four questions, but I guess we can cover them up later on because it's
yeah.
already way past 7 p.m. All right.
Okay.
Thank you so much, Doctor. It was amazing. I mean, you answered every question very detailed and with a lot of patience. Thank you so much.
Thank
And
you.
thank you for giving us your time.
It's a very good initiative,
All
especially
right.
thanks
Thank you.
to Dr. Jaideep and Dr. Narendra for this initiative. Really, I thank you.
All right.
Yeah.
Thank you so much. So we'll end the session, everybody. Thank you so much. All right. Bye bye, Doctor.
Bye bye. Thanks.